I think, like we did in the morning, it is time for a session of clapping and dancing. You're all ready for that? So I'll be covering a little bit about spine, the recent advances in spine with its minimalism. In fact, I was asked to make a talk as simple as possible because I think my audience was, most of them were non-medicos. But I was just talking to my colleagues. Most of the facilitators knows as much as the doctors know nowadays. I think we come across quite a few of them, quite knowledgeable about what we already talked to them. So I think, so I try to make my talk as simple as possible. We, along with my colleague, Dr. Madhusudan, who is a orthopedic joint replacement surgeon, attached to a hospital called ProMed, which is I may not call it a boutique hospital, but it's a smaller setup, but we provide the best of orthopedic. It's an orthopedic-centered hospital. So I would like to start my talk also with a quote. Nothing happens by chance. Everything is a meaningful coincidence. So let me start with the different causes of pain. And as my organizers told to make it as simple, I just come out with few causes of pain in the aging skeleton. The commonest we come across is what we often call it as the softening of the bone. In medical terms, we call it osteoporosis. And the other few causes are like the muscle sprains and strains causing pain, and inflammatory changes like bursitis, osteophytosis, deformity and degeneration, and hypertrophy of the joint capsule. And if you want to remember it better way, you can remember my name. If you remember my name, you will get all the causes of the back and the causes of different causes of pain. So talking about the minimally invasive spine surgeries, at this juncture, I would really thank the pioneers in getting this done, because I would like to thank the biomedical engineers and scientists who come out with excellent gadgets, who try and help us doctors as well as the patients to achieve these goals, which is the minimum blood loss and makes the recovery fast for the patients. And of course, the hospitalization is so less, and cosmetically we give them a very small scar. So talking about the normal spine anatomy, I would like to just show you the, can you see the red mark? No. So this is the spine, where you can see the neck portion called as the cervical spine, and the chest portion is the thoracic spine, the lower back is the lumbar spine, and the tailbone region is called the sacrum and the coccyx. And you can see the area of the vertebral bodies, which in between the two vertebral bodies we have the disc, which is like a cushion, helping our movements, helping the shock absorption in the spine. And you can see the nerve roots coming out of each vertebral region, which enters the limbs and the different parts of the body. So the commonest cause of back pain, generally we call it as disc prolapse. Commonly, as a layman term, we call it as slip disc. You can see here the normal spine, where you can see the area which is the the normal area, and in the lower portion of the area you can see that the disc which has come out. And when you scan it, you can see the area where the disc is really popped out, and that's the cause of pain. And in the cross-sectional area, you can see a large disc material within the canal causing not only pain, often we see a weakness in the legs, numbness, and difficulty in walking. So, coming to the surgical indication straight away, we do a procedure called discectomy, where the removal of the disc needs to be done so that the patient gets relief from pain, and in addition we achieve the decompression of the nerve roots. So these procedures has been evolved over the period of time, where in the past we used to do it at the incision of about 4 to 5 inches. There was a lot of removal of the bones, there was a lot of blood loss, there used to be a instability created in the spine. But as time passed, with innovations, we have come out with minimalism, where the area of the spine which is with the problem is approached, and you can see gadgets where you can use this, and the incision required here would be not more than 1 inch. So as years passed with innovations, we are able to do this minimalism. And these small apertures, we use our gadgets and the instruments to approach the spine where the disc is prolapsed. But the more recent advance would be even more smaller incisions, where we do it with endoscopic spine, where we have gadgets which is as small as 8 millimeters, where it's also got a scope, it's got the working canal, and it's with this, the space for the instruments to be passed. And this is how it appears, a small incision done across in the paraspinal region, and the spine is directly approached for the removal of the disc. And you can see the incision is as small as less than a centimeter. So this is how modern technology has helped us to help the patients to achieve more minimalism. Can you run the video, please? I would like to show a small video of 1 minute where
Endoscopic lumbar discectomy is a minimally invasive procedure for treating lumbar herniated disc.
you can see
First, a thin guide wire is placed under X-ray control down to the involved level of the spine. A tapered dilator is inserted over the guide wire. A small tube is inserted over the dilator to create a portal to the herniated disc. The endoscope is placed through the tube and the discectomy is performed. Using special instruments, your surgeon can now microsurgically remove the herniation, thereby relieving nerve root compression. The incision is closed with a stitch or two, and the procedure is complete.
So definitely it is not as simple as it is shown, but this is how it is. So this is about a little about the spine where disc surgeries are done with minimalism. Second common causes, I think, across the world, even in African countries, with the problems of obesity and with the work, the lifestyle and the work pattern they follow during their routine working atmosphere. They do a lot of weights. So there is often patients coming with a condition called spondylolisthesis, where we see the bone slipping one over the other, causing a lot of back pain. There will be a lot of nerve compressions. There will be a lot of difficulty in walking. They are unable to walk even 100 meters. So that is the time they are almost crippled. So here when we offer treatment, we need to stabilize the spine with the support of the implants, and we need to fuse the spine. So these are the conditions we see across on an X-ray. And this is how it appears on a CT scan, where you can see the bone propping out and causing a step in the spine alignment. And you can see this on MRI, causing a lot of degeneration as well as space reduction. So we need to stabilize using pedicle screws and rods and bone grafts. So this was how it was done in the past, where quite a bit of opening was done, and you can see the screws passed on either sides. But innovations again has helped us to do this with the same achieving the same principles, but with small incisions, where these are the gadgets, small tubular gadgets used, and then we pass the rods and the screws across through these gadgets. And again, we are able to stabilize in this manner. So the incision would be rather very small, and recovery is definitely faster. And this is possible even for two-level problems, where we can achieve stabilization at 2 levels. Again, this is another condition where we come across a huge, large disc coming out, and minimalism can be used to decompress and stabilize the spine, as you see on the X-ray. Another common cause which we come across is osteoporosis, where the patient can develop hunchback, where there is a softening of the bone, and they often land up with some pressure on the vertebral body with collapse. And this can also happen with metastatic spread of cancer to the vertebral bodies. So here, the X-ray would appear with a fracture of the spinal vertebral body, and then you can see the CT scan where the vertebral body is scattered. And then we need to do, and we are doing it with minimalism, where we use gadgets, and with small incisions, the tube is passed into the vertebral bodies, and then we inject bone cement into the area of the fracture, so that the stability of the bone is achieved, and the pain relief is quite dramatic. And this is how it appears on the X-ray post-surgery. And you can see it's again done with 2 small incisions. So this is all about a few things which I thought I will cover using these gadgets and minimalism. Of course, in our center we do surgeries which requires maximalism, where we do deformity corrections, we do scoliosis and stuff like that. But this was my topic for the day. So before I end, I would like to just tell about, it's done? Yeah. So when you stop learning, you definitely stop growing as well. And the next. Nothing? Okay, thanks for the patient hearing.